And so let's talk a little bit about how we should be approaching genitourinary syndrome of menopause in terms of treatment.
I'm not sure how guidelines are delivered here in Australia, but in Canada, we have the Canadian Menopause Society guidelines. And I think that if I look across the borders in terms of the North American Menopause Society, now called the Menopause Society, as well as the International Menopause Society, those guidelines are very similar. So I'm assuming yours would be the same.
They are.
In terms of first-line therapies, you know that we talk about the lubricants and the moisturizers, and this is really for patients who have very mild symptoms. So a lubricant to me is like providing providing some barrier to friction. And I often relate that to what we use on our face. So to me, a lubricant is like makeup on the face. You just use it episodically and periodically, either when you need to go out, you put makeup on, or when you want to be intimate. But really, lubricants don't change the actual physiology of the tissues. A moisturizer, and so lubricants are only used with intercourse. Moisturizers are used with or without intercourse, and it's the same thing as putting a moisturizer on your face. It provides moisture, and it can be used on a regular basis. But again, doesn't change the actual physiology of the tissues. And then in terms of the second line therapy, which to me is actually first line because we know that lubricants and moisturizers only provide a very minimal amount of relief, is when we talk about the local vaginal estrogen therapies, which we have many of them. And so when I speak with patients, I really emphasize that there are a lot of different products that we have, and the best one that you should use is the one that you think you're going to be the most compliant with, because we want to help patients recognize that this is a chronic progressive condition. And so if we don't continue to treat it like we would high blood pressure or diabetes, her symptoms will progress. And so we talk about creams, we have ovules, we have inserts, we have a vaginal ring. And we also have a new product in Canada, which I believe is also available in Australia. It's called Prosterone, which is a vaginal DHEA as well.